So I see quite a lot of patients with shoulder pain, and what tends to happen is you treat the patient during the appointment, help the symptoms. You then give the patient a handful of exercises to take away, which they can do in their own time. The idea being that the treatment during the session gives you a window of opportunity. Like I said, it calms symptoms down, and it gives you a chance to take some homework away and continue the good work and improve the problem in your own time. Quite often the problem that I'm finding is that it's difficult for patients to remember the exercises. Sometimes they're complicated, especially shoulder problems, rotator cuff problems demand some quite specific exercises that need to be done, which will help them. And sometimes, with the best will in the world, the patient just can't remember the exercises. Even if you write them down, they can't remember exactly how they're done properly. Sometimes they just don't have time to do them at all. And so what I've tried to do in the last few weeks actually is patients who come in with shoulder pain and they've never seen anybody about it before, is to just give them one exercise to begin with. And the one that really, really helps, and one that I would say, if you're going to do one and start with one, this is the one to do. And I call it dangling. So what you do is you get a weight in your hand, and you allow the weight to pull the shoulder from the joint down gently for 4 or 5 minutes. And I found that patients, if they just do that one thing once a day, that will start to improve things really well. So actually I've got a kettlebell just here. I'll show you what I mean. So something like this, but if you don't have something like this at home, just get a detergent bottle or something that's got a handle on it that's got a little bit of weight to it. And all you do is stand with your hand on a table or on the back of a chair, hold the weight and just let it dangle by the shoulder. So from the joint here, the arm is completely loose, and just using your body, just give it a bit of momentum like this and just allow it to swing in a circle like a pendulum round one way for a minute or so, and then allow it to swing round the other way for a minute or so. And if you do that for 5 minutes in the morning or in the evening once a day, that will really start to help shoulder pain. So I'm not saying that it's going to help every shoulder problem, and I'm not saying that it's going to completely resolve the issue, but it's one of these things that more often than not really does start to help. And then in the second and third sessions, we can start to introduce more exercises when you're a bit more confident. I just wanted to throw that out there. Sometimes little and often is good. Doing something properly and regularly is better than doing a number of things badly or not at all. So that's a thought for today. And I'll catch up with you soon. Thanks.